Welcome again, everyone, to today's National RTAP webinar, Transit Employee Health and Wellness Programs. My name is Liz Taylor, Assistant Director here at National RTAP. For those of you not familiar with us, the National Rural Transit Assistance Program is a program of the Federal Transit Administration with a mission of addressing the training and technical assistance needs of rural and tribal transit operators across the country and to support the state RTAP programs. Before we introduce our presenters today, we're going to do a couple quick polls just to find out more about our audience. So let me launch the first poll. So you should see a poll. If everyone can please select what best describes your agency, company, or organization. And we'll keep the poll open until we get a pretty good amount of responses. Okay, so 80% have voted, so I'm going to close that and share the results. So the vast majority of you are rural transit providers. That's great. So now we'll do the next poll. So whether your organization currently has a wellness program or any initiatives related to employee health. Okay. 88% voted, so I'm going to close that. So pretty even, but most of you do something. So here I'm sharing the results. Most of you do something for employee health, so that's wonderful. Hopefully you can learn something new today. So back to the presentation. Hide. So today we are fortunate to have two great speakers. First, we have Erwin Reitzma, who works for the Wyoming Independent Living in Laramie, Wyoming. He's the program manager for their Transportation Check program, a grant-funded program which assists those in the eastern half of Wyoming who have long-term disabilities that prevent them from driving. Erwin also has a personal passion for living healthfully and helping others achieve their health goals. He serves on the Wyoming Independent Living Wellness Committee, which oversees and plans wellness activities for their employees. He also delivers health and wellness classes and presentations. Jill Statham is the Administrative Services Director with Oats Transit. She's been with the agency since 2012 and is responsible for compliance and legal issues, development, grant writing, marketing, and the company wellness program, which she started in 2013. Jill is a certified community transit manager, a national certification program for transit professionals. She has presented at the National CTAA Expo and state conferences. Oats Transit is a transit provider for seniors, individuals with disabilities, and the rural general public in 87 Missouri counties. The company has more than 750 employees. So that's a large rural transit provider. So now that you know a little bit more about our presenters, I'm going to turn it over to Erwin. So let me just bring up his presentation slides. And Erwin, it's all you.
It's all me. Good afternoon. I appreciate the little confidence booster, great speakers that you gave us there a little bit, Liz. This afternoon, we're going to talk a little bit about wellness programs, and I often get a question when I'm doing presentations for transit providers. What does this have to do with transit and transit agencies? And quite often my response has something to do with, well, if people are not well, if your workers are not well, if drivers are not well. I work in a very rural area in Wyoming. And in Cheyenne, if a driver is not well, they have substitute drivers in other places around the state, maybe like Rawlins, Wyoming. If a driver is not well, it can make a difference in whether someone is able to get to their medical appointments, whether they're able to get food, whether they're able to get to the places that they need to go during the day. Some of, in fact, quite a few of our transit providers around the state might not have an alternative driver for the day. And so it can impact a lot of people's lives if we aren't well. And so one of the things that Liz was wanting us to kind of talk about a little bit was stress, overweight issues, fatigue and alertness. Well, we go to the next slide. I was chatting with someone this past summer, and it was a week before a presentation that I had done for YTrans, which is the Wyoming Conference of Transit Providers each year. And we were talking about health. I told him I was going to be doing a health presentation. And so he gave me this advice. He said, well, I could help out with that. I could do a health presentation. I said, yeah, what kind of things would you suggest? And he said, well, this is my advice. And you'd have to consider the source a little bit. Kim is a very colorful individual. But he says, don't drink, don't smoke, and eat your veggies. And that's pretty good advice. It's not that it's bad advice, but we can offer a lot more than that through a good wellness program. This advice is good, but it doesn't address all of the issues that we face in our workplaces. Next slide. I heard someone that I know just a week ago said, boy, I'm really thankful I've got a good desk job. And a desk job can mean a lot of different things within our occupations, our careers in transit. It can mean someone in an office taking phone calls, taking reservations, organizing who is eligible for various services. It could be the bus drivers. They all essentially kind of have a desk job in the fact or in the sense that they sit a lot during the day. I know when I was getting a master's degree when I was younger, I did a lot of construction, and I remember being on a roof during the winter as the snow was coming down and it was cold, and I had this thought go through my head, I can't do this for the rest of my life, slipping and sliding off of roofs and framing buildings. You know, we might not, within our transit careers, might not get nails shot through our fingers on cold days, but our occupations do have other hazards. Why don't we go to the next slide? One of the hazards within our occupation is that of sitting. And if you look at this slide, you notice the first point there, the Australian Diabetes, Obesity, and Lifestyle Study, which followed 9,000 adults over the course of about 7 years. They found that for every hour spent watching television each day resulted in an 11% increased risk of death. Interesting, here in America, the American Cancer Society followed 100,000 Americans over 14 years. They found that men who sat for 6 or more hours a day had a 20% higher overall death rate. That's fairly significant. If you go to the right of that, you notice that women who sit for 6+ hours a day have a 40% higher death rate. It's interesting that, you know, a lot of times I know we just here in Laramie, we're a little bit behind the curve of some of the bigger cities. We just got our new Planet Fitness. And so the Planet Fitness, if you're familiar with them, you can go and exercise 24 hours a day. It's non-judgmental, supposedly, and so they encourage people when they get off work to come and exercise. It's interesting that the statistics in these studies were not affected at all by the exercise that people did after work. So if you're sitting for 6, 7, 8 hours a day, and then you get off and you go to your Planet Fitness and you exercise for an hour or 2 or 3 or 4, it does not affect these percentages. The effect of sitting for 6 or 8 hours a day takes its toll whether you exercise or not. Mortality, it says, even increased among those who ran or swam or exercised even just for an hour a day. Next slide. So it's important to understand within our organizations, within our careers, for drivers, for those in the offices, that your health can be affected a lot by what we do during the day at work. You notice here that an hour of standing burns 50 calories, 10,000 calories a year just in standing for an hour, the equivalent of 4 marathons. A lot of people don't think of themselves as marathon runners, but if you just stand for an hour a day during the course of a year, it's the equivalent of 4 marathons. And standing is important. Breaks can be as short as a minute, generally about every 20 minutes. We're suggested that we should get up and walk. Doesn't have to be strenuous. It doesn't have to be, you don't have to jump up from your desk and go out and run around the block 5 times and do push-ups and calisthenics. It can be just very brief and very casual. It can be just walking, just getting up, using the muscles in your legs. You notice in the third point there, the walking, moderate exercise is beneficial. You notice that mortality rates change based on how much exercise one does get. 60 minutes each week lowers mortality rate by 3%, down to if you get 1 hour every day, it lowers your mortality rate by 24%. One of the big issues with sitting and why it's dangerous is the damage that it causes to the endothelium lining in our veins and arteries. We have about 100,000 miles of veins and arteries throughout our bodies. All of them just a very thin lining or cell lining. If we go to our next slide, you'll see kind of a picture. This would be the wall of an artery. And you notice on the inside, there's what is labeled the endothelium. It is a lining that lines every single vein and artery within our bodies. It's currently thought that the endothelium is kind of the key to a long and healthy life. The endothelium is something that a lot of people don't read about every day. It's not something that is talked about on the news every night, but it has a lot of functions within our body that promote our health. The endothelium is a organ within our body. It's a single cell lining of every vein and artery that prevents inappropriate blood clotting. It helps in the relaxing of our arteries. It promotes normal blood pressure. It prevents inflammation and plaque buildup. It facilitates glucose uptake, proper blood vessel function. It helps in the production of nitric oxide, which is what is needed for healthy arteries. So this endothelium is considered one of the keys to healthy living, and sitting for long periods of time creates endothelial dysfunction. If we go to our next, let's stay on this slide for just a second. You know, a lot of wellness and health emphasis is put on exercise. It's interesting that more emphasis needs to be put on diet a lot of times. If you notice the 3 points on this slide, green tea improves endothelial function even in smokers. The spice turmeric improves endothelial function, as well as up to an hour's worth of exercise, aerobic exercise. Turmeric is a spice that is quite often found in curries and Indian dishes. Many of you might use turmeric. If you don't, you should consider adding it to your daily regimen of spices in your foods. And it doesn't take a lot, just a pinch of turmeric makes a big difference. And of course, smoking causes a lot of endothelial dysfunction, cardiovascular disease, lung diseases. We're all familiar with that. We go to our next slide. One of the areas that we wanted to talk about a little bit was worker alertness. And certainly that's something that affects transit. I know recently in talking with one of our providers in Cheyenne, they have recently made some changes in all of their routes to move all of the stops away from the close proximity to the doors of shopping malls and shopping centers, Targets, Walmarts, any of the places, Albertsons, any of the food places, because they're wanting to make sure that the drivers don't hit people as they're going through parking lots. Worker alertness, especially in transit, is important. We had someone in Cheyenne hit a pedestrian just this past year. So worker alertness is important within transit. It's interesting that if you get on your computer and you were to pull up Google and you were to start typing in "why am I," Google will actually finish that for you. And the two of the first responses that you're going to get there is, "Why am I so tired?" or "Why am I always tired?" Pretty much consistently, if you look at how those searches are derived, if you look at the numbers are fairly consistent throughout all of the states. There's a couple of states that I noticed that those searches are a few less, but most of them are fairly consistent around the entire United States. Why am I so tired? Why am I always tired? Well, one of the first responses that Google is going to give you comes from WebMD, and I'm not suggesting WebMD is good. I'm just using that as a platform. What they suggest within WebMD is pretty good. Their 5 points suggest that what you eat, how much water you drink, how much you sleep, how much you exercise, and how you handle stress all affect worker alertness. Why don't we move to the next slide? So if we just take a look at those 5 points briefly, the what you eat, healthy diet of fruits and veggies, lean proteins, they're going to provide energy without the sugar spikes and the highs and lows. It's interesting, University of Maryland did a study a while back. They recruited volunteers. They suggested, actually they put them on 2 different meals on 2 different days. Day 1, they had a low-fat breakfast. Something you might consider would be like oatmeal. Day 2, they took and fed their recruited volunteers an Egg McMuffin from McDonald's, something that we recognize might be high in fat, highly processed. The difference between the two, they monitored their recruits for 6 hours after breakfast. Interesting, on the day that they had the low-fat breakfast, they witnessed absolutely no change in endothelial function. On day 2, when they ate the Egg McMuffin, endothelial function dropped within that first hour. The drop in function peaked 4 hours later. And of course, this function test is done by a cuff on their arm. It took 6 hours for endothelial function to return to normal after one Egg McMuffin. What you eat and how alert you are, how your body responds, has a lot to do with what we eat. When we go to our next slide, what you drink. And a lot of people, begin their day. One of the polls we could have had at the beginning of this webinar was how people start their day or what they drink at the start of their day. And a lot of people, I'm sure, would raise their hand or would note that they drink coffee first thing in the morning. The first point there, many Americans attempt alertness through caffeine, whether it's coffee or Red Bulls or whatever it might be. Those can produce nervousness, irritability, insomnia, rapid heartbeat, high blood pressure. We have to kind of know that when we awake in the morning, our bodies produce its own stimulants. The cortisol that's produced in your body is at its lowest around 3 o'clock in the morning when you should be asleep. Cortisol is at its highest around 8 o'clock in the morning when you should be getting up and getting going. Cortisol is one of those chemicals that our body produces that is also affected by what we produce or what we put into our body. So if we get up in the morning, the first thing you do is you either warm up some old coffee or make some new coffee. You open that Red Bull and you introduce caffeine into your body. Your body starts signaling your brain, starts telling your body, hey, we don't need to produce cortisol because we're already getting caffeine every morning. And so a lot of times people are affecting how alert they are and how their body works by the caffeine that they're introducing. It's suggested nowadays that it's not bad necessarily to drink coffee, but that you should wait to drink coffee until about an hour, hour and a half after you awake. So getting up in the morning, we're going to have to speed up a little bit, and we will. Getting up in the morning, water is the best thing. If you go to the next slide, worker alertness. Interesting that almost 30% of bus drivers say they never or rarely get a good night's sleep on work nights. The next slide, exercise. Studies show that when people begin exercise, they typically have a lot more energy and express feelings that they have a lot less fatigue. If we go to the next slide, we realize that handling stress is important for alertness. What we do to handle stress, the breaks we take, the time off we take. It's not bad to take a day off from work. Healthy at work, the next slide. This is a slide that I just pulled off the internet. So this would be something that we would use within Wyoming Independent Living, just to kind of go down through and break down some different areas that we could concentrate on in our wellness program. If we go to the next slide, you notice some different areas. This is something that we've also suggested to people to kind of take a look at how they're working at their desks. Treadmills, whether it might be a desk, a standing desk. I'm standing currently at a treadmill desk, and if I'm in my office, that's where I'm usually at. If we go to the next slide, the roadmap to wellness. This is kind of a little roadmap of how we have worked through our wellness program. We've identified needs through health screenings. We've started a committee. Leadership is important, finding people that are committed and invested in the wellness program. Getting the correct people involved, incentives. We do cash incentives, day off incentives, a variety of different programs. We try to create a different program every few months. Challenges, goal setting, helps, diet, exercise, health, newsletters, all things that we try to do within our program. Surveys and feedback is important. If we go to our next slide, wellness baseline, the title of this slide. One of the things we did was a free health screening, and that we found was very helpful for people. A lot of times people have not been very aware of what their numbers are, and so we've done a little bit of work. The 4 areas on the right were 4 areas that we pulled out from that screening based on results for every employee, and those were areas that we've put some special emphasis on. The next slide talks about employee involvement, and one very fun thing we did was a healthy breakfast challenge. We had all of the employees get together. We had a healthy breakfast challenge. People kind of balked at it at first, but it was very impressive with how that turned out, and everyone enjoyed it. A little scorecard. We had a winner, winning team at least. The next slide talks about newsletters. You'll see a couple copies of some of the newsletters that we try to emphasize various items regarding health. The next slide talks about incentives and reimbursements. We do a number of incentives. One of the reimbursements that we do is $150 for any sort of health-related costs that you might incur. It could be clothing, could be gear, it could be a new tire on your bicycle. Meal planning helps. If you go to the next slide, meal planning helps is something that I try to publish. These are things that I publish frequently and send out in emails. Just some ideas about healthy meals and things you can do to add some additional health. And the next slide talks about health reminders. And this health reminder, we do little tents and various things around the offices. And so this is a trifold tent that we did at one point. The last slide, and then I'm done. I guess we try to emphasize that your health is your health, and that you're the one responsible for it, and you can make a difference and a change in your health. Thank you.
Thank you so much, Erwin. That was great, and I hope I definitely learned something about my blood vessels and I started standing up. Although I don't have a standing desk, maybe I'll look into it. So thank you. And hopefully if anyone has questions, we will have some time later. So let me pull up Jill's presentation, and Jill, go ahead.
Hi, this is Jill from Missouri, and I just want to go ahead to the next slide. Next slide. I wanted to tell you a little bit about Oats Transportation to get started, just so you can see how diverse our company is and how we still make a wellness program work for us. We are a large provider, as Liz said earlier. We serve 87 counties in Missouri. We're largely a rural general public provider, but we also serve seniors and individuals with disabilities in urban areas through contracts. We have a fleet of over 800 vehicles. We employ 650 drivers and 100 office staff. So that in itself creates a big challenge when you've got them spread out all over the state and accommodating everyone in programs that we offer. Our headquarters is in Columbia, Missouri, and we have 8 regional offices in various cities, and then we also have 4 satellite offices, and we provide 1.5 million trips and travel nearly 14 million miles a year. Most of our service is a shared ride demand response. We are door to door, and again, that creates a problem when we have to have drivers that are fit for duty and able to provide that service, because it's not curb to curb, it's door to door in most of our service that we provide. We also run deviated route systems in some small towns, but we do not have any fixed routes. We also have some intercity express routes that take riders from smaller communities to the larger urban areas. Next slide. Why we started an employee wellness program. We looked at this for a few years and decided, first of all, our company policy is that our drivers are required to take and pass a DOT physical before beginning employment and maintain their medical certification showing they're fit for duty. With that policy comes a lot of health concerns and health issues. We had fewer people able to get a 2-year medical card, and when that happened, they were only able to get a 1-year, 6-month, or 3-month card. That cost our company more money. Because we are the provider, or we pay for those physicals, each time a driver was having to go through more than one physical, we were being hit with that cost. In 2014, some of the regulations changed and said that the federal motor carriers required that the examinations must be conducted by a licensed medical examiner. Our goal is to ensure our drivers are safe and physically fit to drive commercial motor vehicles. So that was really our main goal of starting the program, to ensure we had drivers that were able to safely transport our best cargo, which is our riders. Next slide. Our goals for our program primarily is to enhance the health and wellness of our drivers by providing the tools necessary for them. To improve the driver's health so they can pass their DOT physical, obviously, and that's required to be an Oats Transit driver. To lessen the amount of time away from work because of health complications, and improve employee morale by having fun group activities that foster a culture of caring for them. And we'll talk a little bit more about that in a slide coming up. Help minimize workers' compensation claims, be creative and keep it fun to increase participation, and increase and strengthen healthy behaviors. Next slide. Your plan should be realistic, and I just loved this slide the graphic that was thrown in there, and that's really something to be considerate of when you're thinking about starting a program, or if you already have one. Be realistic in what your goals are for the program and stick to what works for people. Don't expect people to be marathon runners to participate in a wellness program. You should have something for everyone. Next slide. Don't let your challenges get in the way. One of our challenges is that we are a largely rural population. The way we're established is that many of our drivers don't start and stop their day from a regular office. They start and stop their day from their home. So that really becomes a challenge in finding programs that work for everyone. And because we're rural, we can't find places that have fitness facilities and gyms in every single area. One of the solutions we found was to create activities that were conducive to our demographics. Couple of tips: be creative when you plan your program and get your staff involved. We've done that throughout the program we've come up with some great ideas from some of our employees that have participated in the program. And also know that what works for most is not going to work for everybody. And keep that in mind as you go through. Don't get discouraged when you see fewer people signing up for some programs and not for others. Next slide. The benefits of starting a wellness program: employees have a feeling of support from their employer, and we do care about their health. Increased productivity level, reduced employee sick time, recognition is always important, and of course prizes. Money, awards, and certificates of achievement go a long way in recognizing people for participating in your programs. Next. Some of the activities and challenges that we have done, we've tried to mix it up and do a variety of different things. We have some that are weight loss related, and I've put just a few of the challenge, and we've tried to be creative and change it up a little bit in how we did some of those, so it wasn't always just based on weight. Another thing that we did was, so that it was fair and more equitable to everybody, is we do it based on percentages for the most part, and not based on pounds, because we all know that people lose weight differently. And, you know, depending on what size you are, it may be more difficult, it may be easier for you, it varies. So we try to base most of them off of percentages. Our exercise programs that we've done, that was something that was requested when we first started our wellness program, is that they couldn't be all weight related, because some people felt like they were at a good weight where they wanted to be, but they still needed exercise to be a part of it to help with things like blood pressure, you know, heart related illnesses, that sort of thing. So we tried to mix it up and try to do, like, our first wellness program would be a weight loss, and then followed by exercise, and then back and forth. But then also throwing in some classes in there. We do some lunch and learn opportunities. When we do driver training programs, which we do 3 times a year at each of our offices, we would try to put something in there wellness related, and it may not be every single meeting, but it is in there frequently. So we remind drivers and office staff about various health related topics. Ergonomics was a discussion that we just recently had from one of our chiropractic offices, and that was kind of an interesting conversation in how you sit and stand and move about your day, and how that affects your health and wellness. Some of the other things we've done is have group walks, after work Zumba. Some of our facilities have small facility or have a exercise room in them. We have about a $10,000 budget for our wellness program. So as you can see, it doesn't have to be anything major. Most of that money that we use or have in our budget is for prizes and incentives. And I would say probably about 10 hours per month is what we spend on this, or what I spend on this, to put a wellness program together. So again, it doesn't have to take a lot of time. And we have about a 25% participation rate from our employees. And that doesn't sound high, but when we have, 750 staff, we felt like 25% was pretty good. One of the goals I still have to work on, and it's a challenge for us, is a smoking cessation program. And the reason it's a challenge is because we are spread out all over the state, and some of the drugs, as an example, are in a higher tier on our insurance plan that help with people to be able to stop smoking. So it's definitely not something that we're giving up on. It's just we want to think through it so that we can get the best program possible to reach the most amount of people in our population area. Next slide. Some of the things that we've done, and talking about keeping it fun, we had some t-shirts that we had printed up. We kind of had our, because, you know, the Oats logo, we tried to incorporate that into it, and just trying to make it fun for people and give them something cool to work toward. Most of our challenges involve prizes, and as an example, one that we're undergoing right now is if you lose 5% of your weight, you win $25. If you lose 10% of your weight, you win $50, and then the top 2 losers win $200. So there's a big incentive for the more you lose, the more the cash reward is. We get a lot of feedback from our employees, and it's very encouraging and helps us to keep going with the program. Next slide. I wanted to share some of our success stories with you so you can kind of see some of the different things and what we've done. We've had a driver that lost 54 pounds in 3 months, and that was our first challenge that we started in 2013. We've had some drivers that have been able to walk longer distances. We had someone that, driver Bill, walked 22,000 minutes, and we've done it, we've mixed them up. We've done it by, you know, walking in a certain amount of miles, or walking the most minutes that you can in a given time frame. Driver Ken walked 619 miles in a 90-day program. He spent a lot of that time walking around his bus, and anytime he was on a dialysis run where he may have to wait for a period of time for his rider to come back out, he was exercising. He was able to lose weight and to go off some of his medications. And then, as you can see, the other 2 ladies have lost weight too in some of the challenges that we've done. Next slide. A couple of our other employees, Vicki, she was able to lose 22% in just 6 months, so that's a pretty major achievement. And then driver Joe, he's kind of our poster child. He did an amazing job, lost 23% in 5 months. He looks like a different individual, and he is healthy. He is very outgoing, energetic, and he said he can just tell a major difference, and he is always so thankful for the Oats program of getting him started on the right path. Next slide. Starting your own wellness program. One of the things that we did here was to hire a wellness intern, and that may sound like something that may be not feasible for you to do, but for us, we were able to because for one, we had a local college, and 2, because we're a nonprofit agency, we were able to utilize them and actually exchanged their time, which it was not a paid internship. We were flexible on the hours that they came in, and they were able to work for us at no cost, and they were able to get credits for their class. So a benefit for them was they got college credits. The benefit for us was it was little to no cost for the 1 semester internship. We had some amazing interns. I don't have one currently, but we have in the past, and they've done an amazing job for us. So just something to think about is if you have a community college nearby or a college, many of the students have to get volunteer hours just for doing some type of program, so you can get them involved in it. Establish wellness ambassadors. Find staff that have an interest in health, and get somebody who is enthusiastic about promoting health in your workplace. Enlist a group of people to brainstorm some program ideas, and just have fun with it. Think about different things. They may or may not be achievable now, but you can make short-term and long-term goals with that. Put together a timeline of your activities and come up with registration dates, program end dates, collecting prizes. Keep activity timelines short. That was one of the things that we worked on. We found some that we did for 8 months. We kind of lost some interest about halfway through it, so we've tried to keep it a balance and keep them shorter time frames so that people will stay with it and stick with the activity. And then, as I mentioned earlier, have an equal balance of weight loss challenges, exercise programs, and education-based programs so that you can achieve and get the most amount of people participating. And then also work with your finance department to to establish an annual budget for your wellness. You don't have to start big, start with a small amount and then work up with it. Next slide. Know that you won't change everyone's mindset on wellness. Not everybody is going to have the same outlook on wellness, but even if you can change, you know, just like with Joe and hearing his comments and the things that he's had to say about how the wellness program has changed his mind has really motivated me to keep going with the program. Next slide. Incentives and initiatives. Health club reimbursements are some great ideas. $25 a month wellness bonus for joining a gym, smoking cessation reimbursements. There's a variety of different things that you can do. There's some paid programs online that you can do, offering free flu shots, having an on-site health fair with free blood work screening. The company challenges obviously is something that works well for us because of our dynamics. Cash rewards, a Weight Watchers at Work program. Sometimes those will work in facilities if you have 20 or more employees on site that are willing to participate. They'll come to your site and do the programs. And then monthly lunch and learns. Next slide. Seek out partnerships. We have a great partnership with many of our county health departments. They've been very responsive in getting people weighed in and keeping track of that, and they'll send the information directly to us, and that's without a cost to our employees, so it's a great relationship to have. Seek out partnerships where you can get hospitals and clinics that may donate prizes, or vendors that you work with that may donate prizes, or health facilities that will donate things such as a membership or a free trial membership and a variety of things. There's a lot of resources that you would have locally that are willing to help you out if you just ask. And then also writing grants that are geared toward employee wellness. Next slide. That is all I have for you today, but if you have any questions, we would be happy to take those, and I'll turn it back over to Liz.
Thank you so much, Jill. Thanks to both of you. So let me just pull up my next slides, but a reminder, if you want to download or save the slides to your computer to keep their contact information or to look back at it as a refresher or to share with your colleagues, they're in the handout section of the control panel. Excuse me. And while you're thinking of, just going to start from this slide. So while you're thinking of any questions you have, I'm just going to remind you that our contact information is here. If you ever have any questions or concerns or anything we can assist you with, please reach out to us. And the webinar recording will be posted at nationalrtap.org/webinars within a week. And just we will be sending out a post-webinar survey. We hope you'll fill that out. And all of our other recorded webinars are available on our website also. Excuse me. Speaking of wellness, I can't get over this cold. But if anyone has any questions, please submit them through the questions box, or you can raise your hand and we can call on you and you can ask it over the phone. I do have a couple questions to get started, for each of you. So Erwin, you mentioned your healthy breakfast challenge, and I was wondering what that entailed and how that challenge worked.
That challenge, we kind of divided up all of our employees into groups, and we assigned people to various groups, largely based on where they were at within the state. And so we're kind of spread out across Wyoming, but we do get together twice a year, and it was at one of these meetings that we had everybody kind of come up with a breakfast that they thought was healthy. They were allowed to choose whatever they wanted to make. They did have to let me know what their breakfast was going to be so that we didn't have 5 people making oatmeal. And so once somebody said they were making oatmeal, that was off the table and you had to choose something else. We allowed people to have costumes and to have a theme. You had to actually have a theme for your team and a name. My team was the hobos, and so we were all dressed like hobos. We had a scorecard, and everyone had just a small taste of breakfast. Each team had to make enough breakfast to serve everybody, just a small, very, very small portion. After the breakfast or during the breakfast, everyone was to score each of the meals. We had to actually provide health information on the meal that we were making. So everyone graded them on presentation, taste, creativity, prep time, cost, sodium, fat, all of the information that we had to actually provide for our meals. And then we had a winner. And of course, the winning team got a trophy. And we came up with a fancy trophy. And it took a little arm twisting to get people excited about it, but it was pretty impressive. I got a lot of good comments after we did that this past year, and we're going to do that again this next summer. A lot of good breakfast ideas.
That's really cool. That's fun for kind of team building too, so that's great. Yes. One question for you, Jill, and then we have a question from the audience. My question is about tracking the minutes and the miles for the exercise challenges. Did you have people wear like Fitbits or other trackers, or was that kind of an honesty policy?
Each person got to do their own and how they wanted to keep track of their time, but they did provide, or some used Fitbit trackers. Most kept track of minutes and miles, but the minutes they would track and turn in the tracking sheets. So it was just dependent on what people wanted to do. For us, it became a challenge because so many people are away from an office on a daily basis that we had to do it on an honesty system. And we haven't had much trouble that we know of with that concept. You know, people have to become responsible for themselves, and we trust them that they're not going to cheat the system. And when people are in wellness programs, you can tell if they're being honest or not about it. So I think for the most part, what tracking mechanism worked best for them is what we went with.
Got it. And with the weight, were there, I think you had told me previously that there were weigh-ins with, like,
yes. So with our wellness, with the weight programs, they actually had to weigh in at a facility, whether it be either the county health department or one of our regional offices. And they had, usually we gave them up to a week to get that done at the beginning. And then at the end of the program, they would have a week to weigh in and get their final weigh in. So those were always something that was calculated and had to be done by somebody that could validate the results.
Great. A question from one of our attendees. Could you provide a summary of the vein portion? And I think this is for Erwin. So could you speak a little bit more about that?
Repeat that question. I'm trying to get what kind of information they're wanting.
When you were talking about the importance of activities that affect the health of our veins and our blood vessels and muscles and I forget what it's called, the endothelium or something?
Endothelium.
Okay.
Yes.
So I think a summary of that information.
I guess if we're looking at
go back to, maybe we can go back to that slide.
Yeah.
That might be helpful.
There you go. There's a picture of your artery. When people have heart attacks, they have blockages in their arteries, what is happening is that the endothelium has been damaged. And if you look at just that, it's a very thin layer. This picture that we have on the slide doesn't really do it justice because you would need a microscope to actually see it, right? And so, but it lines every single artery and vein within our body. And this single cell of our body has a lot to do with the health that we either have or don't have. If you have heart disease, and what happens is the endothelium has been damaged through plaque buildup, fatty buildup in your artery or vein. And so what's happened is that is not functioning properly. And that's what happens when they have the heart attacks. We noticed that it is possible for that to repair itself, and typically that's only able to be done through diet. When you go in and you have your stents put in and that type of operation, they smash the buildup within your arteries, but it grows back very quickly. Stents don't last very long, but it is possible that these arteries can heal themselves and the endothelium is able to actually come back. And it's through diet. I don't know if we're answering any of the questions correctly. What happens when you're sitting is that the blood flow isn't needed in a lot of the arteries to the same degree as when you're moving. And so everything kind of relaxes, kind of like in the one picture where we showed the gal on the ball. Instead of using a chair, one of the things that the ball does is it still puts your muscles in tension. And so you still have to use your muscles and you still use the blood flow increases. And so the old adage, use it or lose it, applies to the endothelium as well.
That's great. Thank you so much. I hope that answered the question. If there are any other questions, we still have a couple minutes, and both of our presenters have provided their contact information, so I'm sure they'd be willing to speak more about their wellness programs and what they've learned, what they know about health afterwards also. But if there's no other questions, then we can wrap up. So thank you all for attending the webinar. Thank you so much, Erwin and Jill, for your presentations. I learned something and hope that everyone else did. And before I let you go, just want to give a couple reminders of other upcoming National RTAP events. We have another webinar next week about the National Transit Database. Then we have 3 peer discussions coming up over the next few months. And I've put the links where you can register for those on our website. Although some of them you don't need to register for. The roundtable and the Twitter chat, you don't need to register. And also we are having a conference in September 2019 in Portland, Oregon. We'd love to see you all there. And otherwise, wish you all a great rest of your day, a healthy holiday season, and good reminders during this time of year to keep up exercise and diet and everything like that to help us personally and professionally. So thanks again, Jill and Erwin, and thanks everyone for joining us today.
Thank you.
Yes, thank you for the invitation.
Thank you.